Okay, right. Hi there, everyone. As the ongoing series of talks here for Science Week here today, we have Aziz Rama from Moorfields Eye Hospital, who's going to deliver a very interesting talk to you today on some of the healthcare science options. I know as a careers advisor here, working with students here in the college for many years, often our students focus on sometimes quite a limited things they kind of maybe see within the media in terms of pathways, and there are so many interesting pathways and so many interesting things you can obviously do within the NHS, and I know that there are some really interesting healthcare science options here. So let me pass you over to Aziz, and he's going to talk you through some of these really exciting options, hopefully inspire you to think about some of these within your sort of career planning and things moving forward. Okay, thank you.
Thank you. Good morning to you, ladies and gentlemen. My name is Aziz Rahman. I am the Chief Biomedical Scientist here at Moorfields Eye Hospital. I am a chartered scientist and a chartered manager by background. And I'm also proud to be a healthcare science ambassador. Now, as you can imagine, with science, technology, engineering, and mathematics, your STEM sectors, there are a plethora of pathways with regards to embarking on. It's gone of the good old days whereby people were just looking towards science, medicine, and nursing, but there are separate streams to which I'm sure even I myself, if you were to ask me 30, 40 years ago, was I fully aware of the individual streams? The answer is no. Now, the COVID-19 pandemic has opened up an opportunity to us because people whom were previously perceived to be down in the depths of the lair, the Dracula's sort of lair in terms of the dark laboratories, are now at the forefront of COVID-19 testing, disease management, disease identification, and this is where healthcare sciences, from a sector point of view, that I would like to promote. So, without further ado, I shall bring up my presentation. May I kindly ask Ben, Stefania, can you see that? You can? Fantastic, lovely. So I've been asked with respect from Health Education England to provide you a talk upon healthcare science, a particular aspect of science that I would like you to consider going forward with respect to any potential candidates embarking upon a scientific pathway. Now, if you are interested in a career in healthcare sciences, what do we provide and what opportunities are there for you to embark upon in the foreseeable future? Well, it may be news to yourself, but there are over 50,000 healthcare scientists working in the NHS and the public health sectors. And not only in the NHS, but I myself have got private sector experiences. So there's a wealth of expertise, not only in the public sector, but in private. And it's also common for practitioners to be working in both public and private sectors together. So together we provide the scientific backbone of the NHS. Now, healthcare science, and the majority of people are oblivious, but the pandemic has brought us to the forefront that we are responsible for over 80% of all diagnoses. Now, if you can imagine now, medicine is heavily reliant upon laboratory medicine, i.e. diagnostic medicine. And there's a lot of practitioners, a lot of surgeons, a lot of GPs are requesting pathology tests. Once you mention pathology or diagnostics, a lot of patient management is heavily reliant upon diagnostic testing. And we are responsible for 80%. There's a lot of work that's associated behind the scenes. And this is what we are responsible for. And is the funding enough? The answer is no. We could always do with more. But now that the pandemic has brought us at the forefront, 80% of all diagnostics are responsible by healthcare scientists. Now, in terms of healthcare science, for ease of convenience, we break this down into 4 different sectors: life sciences, physiological sciences, medical physics, clinical engineering, and clinical bioinformatics, a very, very new avenue in the last 10, 15 years. And we shall go and delve into this further. I myself come from a life sciences background, previously 20 years of cancer pathology. And in the last 3 years, I've been working at Moorfields as a chief, representing physiological sciences. In terms of medical physics and clinical engineering, we can always provide you with further information should you wish to go down that avenue. and information of which I shall provide to you at the end of this presentation. In terms of clinical bioinformatics as well, once again, we have ample staff and information should you wish to go down that avenue as well. Now, on a day-to-day basis, now the NHS relies on healthcare science and the scientists, the actual workforce behind the scenes to gather the information about patients. We recommend the best treatment, and in many cases, we also administer ourselves, i.e. we perform a clinical duty. Not only do we do a diagnostic, but also we have patient involvement, and we are responsible as well for the clinical side of managing the patient, managing the diagnosis, managing the disease, or what aspects of the disease that the patient is encountering, and we can manage him or her accordingly. So in essence, we want to personalize the treatment for the patient. So they are responsible for every piece of medical equipment to ensure patient safety. So even a piece of equipment, we need to make sure that this piece of equipment is fit for purpose, it's been validated, it's been verified before we can use it to diagnose. In terms of life sciences, now if you work in life sciences, you will play a crucial role in helping to improve our understanding of illnesses and their treatment. You will also be responsible for developing new treatments for common medical problems. Working in the eye hospital, we have close alliance with the Institute of Ophthalmology, with clinical research facilities. We are looking at future technologies, future pharmaceuticals, future drugs, future techniques in order to promote better eyesight. Now, the majority of your time will be spent in hospital laboratories, no doubt about it, but you may also work on hospital wards or in the community. Now, if you are working in a hospital setting, you'll always be, most often you'll be working in a clinical pathology laboratory, and you'll be analysing different samples from different patients and give doctors the information they need to make an accurate diagnosis. This could be with respect to cytology, in which case we all know that cells are the building block. Cells forms tissues, organs to systems. So I come from a cytopathology background. I also come from a histopathology background. So when you've actually identified certain changes that's going on at a nuanced level in the cell, you can then see what it looks like at a 3D level in terms of tissue representative. And then when you've got tissues being, for instance, let's go with cancer, once you've got malignancy, it will, and invasive spread, you're looking at organs, you're looking at metastases, and you're looking at the whole entire system. Now, life sciences, for ease of convenience, we divide that into 4 areas. The number 4 seems to be quite synonymous, so each with its own particular focus. Blood sciences, genetics, infection science, cellular science. Now, genetics is a very interesting one. When I encountered genetics way back in the late 90s, when I was a bucket by pharmacology, genetics has just came to the forefront towards the late 90s with the Human Genome Project, whereby the entire 23 DNA copies were broken down. You were able to see each of the individual strands, chromosomes, and which parts of the focus of a chromosome. Now, genetics, it has exploded in the last 20 years, and you can imagine at a genetic level, if you can identify what's going on at the DNA and at an RNA level, then you can, preventative medicine, nip it in the bud, as they say. Now, working in Moorfields now, I am now within Physiological Sciences. Now, in this area of healthcare science, you will examine people directly. You shall be looking for any problems in the way that their body is working. So with respect to ourselves, we're looking at anything that goes towards from the eye and beyond. So your optic nerve, if it's anything neuropathology, if it's anything from an eye level, and we're also looking at not only at what's going on right now, but what future techniques, treatments, prognosis we can do in order to try and allay the disease. Now, you'll be part of a medical or surgical team, and your work will involve direct interaction with patients. You will use the very latest techniques and equipment to identify any abnormalities and help to restore body functions such as heart, problems with the heart, lungs, or hearing. Medical physics and clinical engineering. Now, I myself have limited experience with this, so all I can do is comment, and should you wish to discuss this further, I can provide you with alternative information. I have colleagues in other aligned fields that will be able to help you in this endeavour. Now, in this area, You will work closely with other NHS clinical teams, making sure that the equipment they use, such as renal dialysis machines, in our aspect, we'll be looking at ultrasound, optical tomography, CT scanning. These are some of the things that it's absolutely pivotal for us in order to use an equipment to help you with your disease. And we ensure that you'll be functioning safely and effectively. Now, you'll also be responsible for developing new techniques and technology in order to measure what is happening in the body to diagnose and treat disease. Now, as I mentioned earlier, ultrasound, radiation, MRI, clinical photography to explore and record the workings of the body. And all this information is used within the patient management to aid the practitioner. Now, in medical physics and clinical engineering, you can have direct contact with patients in some roles. Now, you might also develop techniques to design artificial limbs, body parts, and improve facial reconstruction for those involved in accidents or born with disabilities. We have a very, very, very exciting prosthetics department here, ocular prosthetics. God forbid, we have patients who have had some form of ocular cancer, in which case the whole eyeball has had to be retrieved, and our ocular prosthetics team have done a marvelous job trying to come up with artificial eyes, which is closely aligned to the other eye, and it looks exactly the same. Bioinformatics. Now, clinical bioinformatics is a relatively new field. When I say relatively new field, I would say in the last 5 to 10 years. But an increasingly very important aspect of healthcare science. Now, they are responsible for bringing together computing, biology, and medicine. Now, staff in these areas develop and they improve methods for acquiring and using biological data. Now, most people think that data is relatively unimportant, but there's a plethora of information that you can seek with regards to data and how you can use data from the patient, from disease cohort, in order to personalize future techniques and treatments so that you can tweak the actual patient as per the right technology, the right drug, the right course in order to help him or her further. Now, these are some of the 3 areas of bioinformatics. You've got the genomics, computing, and health informatics in terms of patient data. Now, this is an example of what was provided to me in terms of what will I do as a bioinformatician. So let's roll this video.
Just a moment, as is, we're not hearing the volume there. Did you enable the sound?
Let's have a look.
Just quickly unshare your screen and reshare it.
Yes, of course. Yes, please. Apologies, you can't hear that?
So maybe if you could stop sharing for a moment.
Yes, of course. What I shall do then, I shall provide this presentation to you, and hopefully you can tweak the settings.
Yes, of course, yes.
And that'll probably make life easier to the audience.
Yes.
Now, can you hear me?
We can hear you perfectly fine.
Lovely,
If
thank
you
you.
unshare your screen, just unshare it for a second. And then once you share again, up there, share content, it says include computer sound. If you click that one, then it will play the sounds.
Sorry, can you see that?
Yeah.
You can, lovely.
Did you click the include computer sound?
Let's see, yeah.
So you have to unshare again and reshare to see that. So up there next to share content, before you share, it says include computer sound, then share your screen.
Include computer sound. Sorry, I can't seem to share content.
Yeah, next to it is like a little button.
Oh, I might have a different.
It's okay. In that case, then don't play the videos. Just this presentation will be provided to the school.
Lovely. Fabulous. You can see that, everyone? Can you see the presentation?
Yes, yes.
Lovely. So interested to hear more? Well, here are some of the job roles which are available within healthcare sciences. As aforementioned, I come from a previous life sciences, in which case we did histopathology, cytopathology. There are other aspects in terms of analytical toxicology. Biochemistry is one of the most common ones, as is hematology and transfusion science. Microbiology is another synonymous discipline in terms of infection control. Bioinformatics and genomics, anatomical pathology such as forensic medicine. I now am at an eye hospital, so I am also responsible now for ophthalmic and vision sciences within the physiological sciences. But you can see now in terms of other disciplines, should you wish to embark upon that avenue in terms of audiology, gastrointestinal, any of the urodynamic sciences and neurophysiology as well as vascular side. And then we also discussed about medical physics and clinical engineering. Now, some of the type of work in terms of some of these areas, you can see the main responsibilities. So we have analytical toxicology, genetics, reconstructive science, and ophthalmic and vision sciences, whereby here at Moorfields, we are amply trying to promote investigating eye and vision disorders for diagnosis and treatment. So I myself am an advocate for ophthalmic and vision sciences. Now, ophthalmic and vision scientists, what do? Well, we help with the assessment and diagnosis of issues with the visual pathway from the front of the eye all the way back through to the occipital cortex at the back of the brain. So we're responsible for that part of the anatomy. Should you wish to go down ophthalmic and vision sciences, what do? Well, we assess the structure and function of the eye and the visual system. We look at people of all ages, abilities, and a wide range of sight and health issues. We perform initial assessments and we monitor disease from start to finish. We also perform a diverse range of tests and procedures specific to eye. So we look at the structural measurement, imaging, biometry. We also perform psychophysical tests such as your acuity, your visual field, and color testing. And we also perform function assessment tests using electrophysiology and electrodiagnosis. We work well within teams and individually, and we have to work as part of a team, not only within internally, but externally, in order for to promote multidisciplinary working. Because as you can imagine, patients are working from department to department, and we need to ensure that we work closely aligned and there's effective communication and intra-team building. So we work within hospitals, opticians, research departments. Now, what are the training routes available into healthcare science? Now, working in healthcare science, it might be easier than you think, certainly much more easier than when I embarked upon healthcare science. I myself was not fully aware of healthcare science, and it seems to be, I seem to have just fell into healthcare science, but it's a lot more easier than you think should you wish to go down that avenue. As well as studying at university, you'll also find apprenticeship opportunities leading straight into jobs. So you're literally building up experience at the same time of building up academic experience. So take a look and kickstart your healthcare science career. Now, I've sent you a link there in terms of should you wish to find out more about healthcare science apprenticeships, and we'll be able to provide you with further information should you wish. Now, if you are interested in becoming a healthcare science professional, there are a number of routes, as I mentioned earlier. You've got your new NHS scientific training pathway. You've got an echocardiography training program as well, should you wish to go into echocardiography. You've also got the high specialist training for registered and experienced. So somebody who's already registered, should they want to go, there should be some pathway, an equivalence pathway whereby you can just slide into the actual training program and not start from the bottom. And if you are starting from the bottom as well, you should be able to start from all the way from the bottom. And we sort of band people down from band 1 all the way through to band 9. So wherever you are in terms of your knowledge, skills and framework, you should be able to slide across and work towards promotion. So apprenticeships normally start at levels 2 and 4 for healthcare science. And as long as you have the right GCSEs, your basic level of science, English and maths, you'll be able to gain entry into an apprenticeship and work towards building your knowledge and skills framework. In terms of entry requirements, we mentioned there, in terms of 2 or 3 A levels, equivalent in order to go through a conventional university. Entry requirements can vary between universities and employers, and courses often specify certain specific subjects as well. So you need to have those subjects at a good grade. I'm not going to, if we're having problems with voice and settings, I'm going to ignore that, and then people can witness that at their own leisure. So in terms of research, we are closely here in Moorfields, we're closely along with the Institute of Ophthalmology and the Clinical Research Facility, and our surgeons are also our honorary researchers, and they're constantly pushing down the barriers of eye disease. So if you are interested in research, you can explore a role that combines your clinical career with research, development, and teaching. Now, clinical academics, as I mentioned earlier, are clinical professionals. We work across healthcare providers and academic institutes. You can also be clinically academic independent, and you can work upon improving your advanced practice and your care through research. And in the majority of cases, our surgeons and our honorary lecturers have a dual role, combining their clinical career with a research career, and in terms of peer-reviewed publications and propelling them and sort of pushing down the barriers of science and medicine. I should ignore that. Oh God. So as I mentioned earlier, in terms of how you will progress, well, these are a few examples of job roles. So you were to come in as an assistant, there's nothing to stop you as long as you have the right opportunities, knowledge, skills, framework, aptitude, experience, learning. You can jump from gateway to gateway to gateway and become a consultant. And if you were to come in at an entry level from another practitioner role, you should not have to come in right at the bottom. You should be able to slide across and work towards the specific portfolio in order to become from practitioner to entry level scientist to senior scientist and to a consultant. In terms of work placement, arranging a work placement is the best way to find out if a career in healthcare science is for you, and I shall leave that heavily with your careers advisor in terms of promoting that avenue for you. But from my perspective, that is the ideal way to go in order to get a sweetener taste of whether or not healthcare science is for you. And just because you may be dismayed at one particular field of healthcare science, do not let that stop you in your tracks. You may find that's another aspect of healthcare science, but do the right amount of research and development in terms of what would whet your appetite. And if something does not whet your appetite, there are other healthcare science fields in which you may trigger an appetite within you. Now, work placement will give you the opportunity, and you try the jobs that you're doing and speak to people already working in that area of the NHS in order to see whether or not it's the right career for you. In terms of healthcare science apprenticeships, now there are currently 3 apprenticeships specific to healthcare science, and the information which will be provided by Health Education England. We have a specific apprenticeship lead and coordinator who will be able to help you. And these have been developed by the actual trailblazer groups, and we are promoting this very, because it gives you an opportunity in order to sort of academic as well as experiential, and you can combine the two in order to quickly accelerate your growth. So you start off as a healthcare science assistant, healthcare science associate, and then work towards a practitioner, in which you gain a degree and state registration. So there's also a range of laboratory engineering, clinical science apprenticeships, although not specific to healthcare science, can be tweaked. So I myself am an advocate for healthcare science. I want to see you in healthcare science. I want to promote you in healthcare science, but I'm not going to stop you if healthcare science is not for you and you want to go into. So there's apprenticeships galore in any of the other non-disciplines, but I hope to see you one day in healthcare science. Now, apprenticeships are there for people of age 16 or over. They're salaried. so your salary during your apprenticeships, you combine your knowledge and skills on the job, and the minimum wage, as you can see, is there for your first year. And among other activities, the NHS and the Health Education England are delivering programs to improve access for those with learning difficulties or disabilities. Now, this includes internships, supported apprenticeships, enabling those with particular needs to gain sustainable employment and delivering benefits to employers who are now able to access a wider talent pool. These are some of the online resources for ophthalmic and vision sciences in which I'm trying to promote. There are other disciplines, as we spoke earlier, and I sort of alluded to. So feel free to gain information from Health Education England within those. But from my point of view, from OVS, ophthalmology, your Academy for Healthcare Science, your optical councils, your optometrists, National School of Healthcare Science, and your imaging department. And in terms of UCAS for your university, there's the web links there below. Other online resources, in a nutshell, 350 careers, one NHS, your future. You'll find sections on their website in terms of frequently asked questions about healthcare science, apprenticeships, the National School of Healthcare Science, and the sort of various opportunities available to you in healthcare science. Now, ladies and gentlemen, I really hope you did learn something that you didn't know about healthcare science. I am here. I am a HEE Ambassador for Healthcare Science. Should you wish to contact myself directly, please do not hesitate. I do represent ophthalmic and vision sciences. I also have life sciences background, but we have ample qualified people within Health Education England, ambassadors, who, if you require any further information, contact them and they'll be able to put you through to the right appropriate ambassador with the right knowledge and skills in order to help you further. This is a test which I think I'll probably just forward you to yourself. So in terms of any questions, I know I have a limited audience today, but please feel free. Hopefully my online resources will be able to help you further. I shall just, and should you require any additional information as well, please do not hesitate. Ben, Stefania, any questions?
Oh, it's great. It's just really, really, brilliant. I haven't got any specific questions as much, but it's just, just know it's an ongoing thing about, just young people, not just them, it's their families and family friends having a kind of awareness of different pathways, isn't it? Because they're the ones that they listen to as much. So, so yeah, brilliant. As I said, I've been promoting these kind of options for so many years, but it's just great to hear from an actual practitioner working now. So thank you. It's been brilliant.
No, not at all. Thank you. But I mean, I'd be lying to you if I said I myself wanted to go into healthcare science. I seem to have just happily landed into this. Had I known the opportunities that were available to me, say even 20 years ago, I would have worked towards a particular discipline. So juggling from life sciences and then finding my feet in physiological sciences, thinking, oh, good God, I had no idea this sort of. So obviously coming through university and going towards biological sciences, I had no idea which sort of field I wanted to go into. So had I known this information beforehand, I would have dedicated towards working further and field. So my career is sort of like a combination of clinical and managerial, but I would have preferred to be less of the managerial, more of the clinical.
Yeah. But it's been great. I've sort of learned bits myself, which I can add into my own practice. So thank you. It's been great.
Fantastic, thank you. I believe Health Education England have also provided yourselves with an online survey with regards to presentation. Myself, is it sort of pertinent? So please feel free to fill in the online survey form. Not just myself, but also was it relevant? I tried to condense it as much as possible. As you can imagine, it's just trying to tailor a presentation towards an audience, but having said that, I have no idea about the audience themselves. So had I been their teacher, I would have been able to tweak it further. So I had to make sure that the presentation sort of encompassed and touched upon a little bit and give them, but then hopefully the online resources at the end, should any of your interested parties and candidates want to know further, they'll be able to just at the drop of a website, they'll be able to seek further information accordingly.
Yeah, that's great. Okay. All right, it's been brilliant. Thank you. Thank you very much.
Lovely, thank you. Roz, is there anything more